As part of our series on medication adherence, I'd like to talk to you about a very important concept, namely primary non-adherence. Now, if you hear the word primary, there must obviously be a secondary, and secondary non-adherence would be when a patient is started on a medication, let's say here, continues with it for a while and then stops taking it, and then obviously there starts a period of secondary non-adherence, which means that in the first period there was primary adherence. Primary non-adherence means that the patient never started, so there is no period that the patient took medication at all, so they are completely non-adherent from the beginning. Now, the importance of primary non-adherence cannot be overemphasized, and I'd like to share with you some interesting data from two big studies from a group in Boston, where they looked at primary non-adherence, what factors contributed to the development thereof, and I'll also share with you some ideas from other studies suggesting some things that one can do. So let's start with the one study done by Fisher et al. On 195,930 electronic prescriptions. This was a group of 75,000 plus patients and more than 1,200 prescribers. Now, looking at this group, they found a number of factors that were related to the patients not being adherent. So let's just start looking at the actual numbers first. So primary non-adherence in this group was 22.5%, meaning 22.5% of patients received prescriptions and never went to the pharmacy. So that's quite a large number. And the factors that they showed here that were important related to the doctor. And they found that if the doctor was male, slightly older, or a primary care physician, such as an internist, a pediatrician, or family practitioner, these patients with these type of doctors tended to have a better adherence. Secondly, there were factors related to patients. Children had better primary adherence than adults, and in this particular study at least, males were about 5% more compliant than females. Note that in many other studies, females were more compliant than males. They also looked at the medication that the patient received, and for antihypertensives, for instance, the primary non-adherence was about 19.5%. For antimicrobials or antibiotics, it was just over 22%, but for pain medication, it was 34.5%. So almost, actually more than a third of patients who received a prescription for pain never went to the pharmacy to get the prescription. A last important factor from this study was cost of medicine, and if the patients had high co-payments, then they also they tended to be less adherent. Now, this is one study, but this was confirmed in a second study also done by this group, and I'm just going to put it next to this. So let's just draw a little line down here. So the second study was done on an even bigger group. We're talking about 423,616 electronic prescriptions, more than 280,000 patients, and more than 3,600 prescribers. And what did they find here? The primary non-adherence rate in this study was almost the same, 24%, which is very high. They did find a few other factors, though, that were also very important, and that was that patients who came from poorer neighborhoods were less likely to go and fulfill their first prescription. Also, they found that patients who received prescription for medication that were not on the formulary of the insurer, so not on formulary of the insurer, were also less likely, probably because of a higher copay related to this as well. And then the interesting one was that if the doctor printed out the prescription and gave the patient a printout, they were less likely to go to the pharmacy than when the doctor sent the prescription electronically and told the patient to go to the pharmacy to get their medication. So these are some of the important factors that were noted in these studies. There are other studies that show other factors as well, but these are some of the things I think that we should keep in mind. The question, of course, is what do we do about it? And I'd like to quickly mention a few things that came from a study from Jennifer Pulinsky, who did focus group interviews with patients who were proven to be primary non-adherent, and she tried to figure out what was wrong. So what did she find in her focus groups? Well, she found that the patients had some specific needs. The one important need was for shared decision making. They wanted to be involved in the process of deciding whether they needed medication or not. So shared decision making. The second one was they wanted full disclosure about side effects. So they wanted to know about their side effects that they could expect and what they should do about it when these things arise. So they wanted their doctors to speak openly about that. And lastly, they felt that doctors should be sensitive to the cost of medicines. This may sound like just bad news all around, but I think there is some good news from some areas in the world, and I think we can learn from them. For instance, there was a study from Sweden that looked at 91,000 electronic prescriptions, and interestingly enough, they found a primary non-adherence rate of only 2.4%. That's like 10 times lower than this other study I mentioned. So clearly the people in Sweden are doing something right, and I think we should go there and learn from them.